Well, one of the first things you notice about a person is their smile, and the doctors at OrthoPros can help you get the perfect smile. With us today is Dr. Kacer, one of the doctors at OrthoPros. Thanks for coming in today.
You're welcome. It's my pleasure. Thank you.
So today we are sort of focusing on braces.
Yes.
I think that's a dreaded thing for, 14, 15-year-old kids to hear.
Yes, yeah. Once they start getting into high school, they start to change the attitude a little bit. 5th, 6th, 7th graders are really actually looking forward to them.
Well, I'm so interested because you have brought these props, and even the metal braces are so different from when I was a kid, when really kids were metal mouth if they had braces.
Yes, yeah, and they used to have the metal bands that actually circled all the way around the teeth. And so that's all you would see is the metal that's there, and really that's where metal mouth came from.
Right.
Yes, and they've gotten better, they've gotten smaller. They're glued onto the tooth now instead of actually cemented around them.
Is that more comfortable?
Yes, it is, yeah. Yeah, it makes it a little bit easier just to tolerate, the braces themselves, and the appearance of it too. And I think that's where it's going, is a lot of people want minimal appearance with it.
Right,
Yes.
Especially as adults.
Yes.
It seems like more and more adults are opting later in life to go ahead and get their teeth straightened.
Yes, yeah, and Invisalign has really helped with that. So there's the metal brackets, which were traditional, and then they have ceramic brackets. So it's the same concept in terms of brackets on the teeth, brackets and wires to move them. And then Invisalign came out, which is actually a series of trays that can be removable out of the mouth as well too. It makes it easier to clean, and especially for adults, they like that because there is no braces at all on the teeth.
Right.
Yeah.
But even these ceramics come in different colors, right?
The ceramic itself, the bracket itself is white, and you have the wires there, but you can change the ties that hold the wires in. Okay. So some people actually have the ceramic ones that are clear, and then they put colors on them as well too, because they enjoy that.
Because I remember a Sex and the City episode where one of the characters, I'm not sure if you're familiar with this, Miranda had to get braces, and a 13-year-old girl walked up and she was like, "Mine are sapphire."
Yes, yeah.
So that's probably more of a trend with younger people.
Yeah. The younger ones really enjoy actually the colors, right?
Yeah.
And changing colors about every 6 to 8 weeks.
Yeah.
And they make it fun, they really enjoy it. Yeah, and then as they get a little bit older, then it becomes more of, let's make this as least noticeable as possible.
Right,
yes.
okay.
Yeah.
But, okay, so tell me more about Invisalign. I know that it's not necessarily for everyone, right?
It can be. I think it depends on the level of experience that you have with Invisalign as well, too. And so that was a common, I don't want to say misconception before, but that was a lot of it was who are candidates for Invisalign. The longer that Invisalign's been around, the more cases that we found can be treated with Invisalign, and a lot of it depends on the doctor experience as well too, in terms of how comfortable they're with it.
Okay.
Yeah, so they're really getting to the point where most cases can be treated with Invisalign.
Even with really crooked teeth?
Yes.
Or an over or under bite?
Yeah, and I always think about it, and when I'm talking to patients, I say it's just two different ways to move teeth. Right, and so you have the brackets, that's been the traditional way. Invisalign is just a different way to move teeth, and the more that you become used to it, the more experienced you are, the more comfortable you are treating more involved cases.
And how do you have to measure your patients with trays or something first?
Yeah, well, we take, and actually what we have now is traditionally there's been impressions that people have taken.
Okay.
And people don't, some people don't like it, and we've gotten a scanner now in the office, so we don't even have to do impressions anymore.
Oh.
Yeah, so it's very nice, a 3D scanner that gets sent to Invisalign, so they come in, no impressions, can get scanned, can see what the teeth are going to look like at the end, and can actually show that to patients beforehand. And then from there, that gets sent to Invisalign. And then what Invisalign does is makes a series of trays. Basically to take you, if you're saying, okay, your teeth are here at point A, it's going to make a series of trays to get them to the final result that we want.
Do people still need to wear braces for about 2 years?
Typically, yeah. In our office, that's about the average treatment time.
So how many different Invisalign trays is that the proper word?
Yeah, yes, yeah.
How many different ones might they need over a 2-year period?
It really depends on the severity of the movement that you're looking at and the type of bite that they have. Most people still finish, Invisalign can tend to finish a little bit sooner in some cases, and in some cases it still finishes around the 2-year mark as well too. So trays-wise, it just depends on how much movement you need.
And what is the cost comparison between Invisalign, ceramic and metal.
Yeah, and that kind of comes down again to how severe the case is and what's involved. We offer, in our office at OrthoPros, we offer the ceramic brackets for the same cost as the metal. So we want patients to be happy with what they have. We don't want that to, a lot of people come in and really want the ceramics, they want that, but they don't want to pay extra for it, right? Because it works the same. So we've made it the same. You can choose either one you want. Invisalign, same thing, it just depends on the severity of the case though.
Okay. Yeah. So they should come in and talk to you.
Yes, exactly. Yes.
All right. Thank you.
Oh, yes.
Actually, we have a little special that I'm going to talk about. Is that what you were just going to do?
Yeah. Actually, we were offering, what, $1,000 off, yes, if you call before the end of October. And we offer complimentary consultations, and that's where we can go over and see what your case looks like.
Cool.
Yeah.
Thank you, Dr. Kurt Kacer is one of the 3 dentists at OrthoPros, and there are 3 locations in town which you can go and see on your screen right now. To find the one that's closest to you, just go to OrthoProsTucson.com or call 290-8787. And right now, as Dr. Kacer just said, if you call, you can get their back-to-school special. That is, any new patient who calls to schedule an appointment now through October will get $1,000 off if they decide to start orthodontic treatment. Just mention you saw Dr. Kacer right here on the Morning Blend when you call. Again, that's OrthoProsTucson.com or 290-8787. Now, how well do you think couples communicate with each other about their financial future together? Amanda had the chance to chat with a personal investor from Fidelity Investments.